Hey everybody, Dr. Anjanavana here and welcome back to my YouTube channel and our new series of sliding to my DMs. So we've got other series on the go called Spill the Tea with Dr. B, as well as our treatment series. So those aren't going away, but I've noticed there's a bit of a demand for specific knowledge regarding the concerns and problems that plague people. And often people DM me on Instagram asking, certain questions about aesthetic issues that concern them. I always advise the best thing to do for actual treatment is to go to your aesthetic provider of choice and have a full-on face-to-face consultation. But there's a couple of things that I can answer in a generalized way that will educate you a little bit. So when you do go, it's nice that you have questions to ask. So one of the questions that we got asked on DM was, what can I do for jowls, sagging jowl? So this is the jowl, that's what they're talking about, the lower face that can appear quite aged, and there's lots of things that contribute to that, starting from, it's like a bone to skin degradation. That's the aging. So your bone is resorbing, that means your jaw is shrinking, your muscles are tightening, your ligaments, some of them are becoming more lax, and then there's fat redistribution in the face, leading to this lot of like jowl look. And as we age, our faces also, they kind of triangular, and then we start to square off a little more and even do this. So that bottom heavy face, that's what the patient or the person on DM was asking. And then of course it depends on your expectations as a person or as a patient. For severe issues of jowls, or if you expect a very tight look, a surgical consult might be the best thing for you to go see a plastic surgeon and consider a facelift. That would be one of the issues. But if you're someone that's not really keen on any surgical treatment, there are other options. One of them is radio frequency. So we have the Endymion device, a multipolar, multi-generator radio frequency. It requires multiple treatments, but there's actually a treatment called V-shaped face, where it's along the jawline, along the face, and it's like an upward movement, heating the skin and causing like collagen remodeling and immediate tightening. You have to have at least 4 to 6 sessions to see something, but even after one session, patients notice upliftment, improvement in laxity. There is also radio frequency that you can do on the inside. So some devices have a little attachment, like a fiber optic attachment, or like a little metal attachment, where you make a little incision, go in there, and it's using radio frequency to tighten from the inside. And then there's injectables. So just went off on the side with all these injectables. So mostly things with high G prime. So high G prime, high elasticity, viscous products. So you can, with hyaluronic acid, also shape the jowls, but just note that you need a lot of hyaluronic acid. I recently saw it was a very popular plastic surgeon, known for, it's called MD codes and certain injection points. So one of the patients had 18 mils, so that's 18 blocks of hyaluronic acid filler placed in the face, but it definitely did smooth the jowl. So that's your personal choice. There are other, there's like calcium hydroxyapatite products, which have a really high G prime. They're highly viscous and they're great for shaping the jawline without absorbing water, except for the one does have a bit of hyaluronic acid in it. So there is a bit of water absorption there. And then if you have minor issues, you can also use a bioremodeling product. This is a high dose of hyaluronic acid, 96 milligrams per ml. So it helps with lift, with laxity, but just bear in mind you have to do more than one, and also keeping your expectations in check. And the very famous polylactic acid, you have to do multiple treatments with this. So they say one for every decade. So if you're in your 40s, perhaps 4 of these treatments for lifting and improving laxity with your own collagen and elastin. So all of these products, they're injected very strategically, sort of near or into ligaments, so it regenerates the ligament as well for lift. With certain jowls, we can even do fat dissolving. So you use a fat dissolving solution into the jowl to reduce the jowl. Sometimes botulinum toxin helps because muscles in our neck attached, they call platysma, are actually attached to the pecs, and they also pull down. So botulinum, so you need, there goes my scalp drop. You need a combination approach, and honestly patient dependent. Also anatomy is important. I've spoken about profile development and mouth breathing before. So breathing through your mouth also creates a certain facial structure versus nasal breathing, as well as like intraoral, like muscular exercises like mewing. All of those things contribute to a better profile, a better jawline. But if you really want to know what to do, the best is a face-to-face consult with your practitioner, and they can advise the best treatment or even a referral course. If you have any more questions regarding what we are chatting about in this video, drop them in the comments down below, like, share, and subscribe. Bye.